Thank you so much for your invitation. I know that it's very difficult to be in here when there is such a beautiful weather outside, this breeze that is coming from the ocean or from the Mediterranean. But unfortunately, it seems that the schedule that Professor Perez organized is actually forcing us to spend most of the day inside since this Sunday. So I'll try to keep it short, and let's see if I'll tell things that are of interest to you. So you have heard in many of the talks since Sunday this notion of the enhanced permeability and retention effect, the EPR effect. It's very simple. It's somehow presented in this schematic cartoon here, and it's based on the significant difference that you will have when you compare normal vessels to abnormal vessels that are developing within the tumor vasculature. So as you can clearly see from this cartoon again, the normal vessels are lined by endothelial cells that are sitting very close one to the other with intracellular openings that are really very small, in the order of a few tens of nanometers, depending on the tissue where the vasculature is developing. When you move to the tumor vasculature, you can clearly see that there are intraendothelial openings, which are called fenestrations, which are much larger, usually in the order of several hundreds of nanometers up to microns. And so the idea behind delivery of nanoparticles to the tumor tissue has been relying on the existence of these fenestrations on a characteristic size that is, as I said, varying from a few hundreds of nanometers to a micron, but in most of the cases around a few hundreds of nanometers. And so if you develop a nanoparticle that is 100, 200 nanometers in size at most, as this particle circulates, it will find its way passively to cross the fenestration and then accumulate into the extravascular matrix. If you are delivering a nanoparticle that is larger, like the gray one, a micron in size, this particle will continuously circulate, won't have the chance to pass across the fenestration, and eventually will be sequestered by the MPS, by the most likely the Kupffer cells in the liver. Now, this is the dogma that has been basically guiding the field of nanomedicine and the development of nanoparticles for cancer applications, I would say, over the last 20 years, since the EPR effect was characterized in the late 80s. We all know that EPR has limitations. We learned about that since Sunday. And so these are some work that has been done by Rakesh Jain at Mass General, showing how the size of the fenestrations, the pore cutoff size, can vary depending on the type of tumor and depending on where the tumor is actually developing. So you see here characteristic size of this fenestration ranging from a few hundreds of nanometers all the way up to a micron. But very interesting, if you look at this table, these are mammary carcinoma cells, two identical cell lines that have been differently injected in different portions of the animals. So the top line is related to a non-orthotopic model, and the bottom line is related to an orthotopic model, so cells that have been actually injected in the mammary fat pad of the animal. And you clearly see that even the location where the tumor is developing may dramatically affect the size of these fenestrations. So, and if you look at these U87 cells, which are the ones used for developing glioblastoma multiforme, you actually realize that the pore cutoff size can even be smaller than the famous 100 nanometers. So relying exclusively on the EPR effect, maybe in some case can be helpful, but in other applications may be absolutely useless. Besides that, of course, nanotechnology, we would like to apply nanotechnology also to treat and image diseases that are different from cancer, for instance, cardiovascular disease, neurodegenerative disease. In that cases, EPR is meaningless. So once you have reached your tumor vasculature and your particles, because they're smaller than the famous fenestrations, can actually extravasate and accumulate in a perivascular position, so in the immediate vicinity of the vasculature, there is another issue, which is the extratumor matrix is actually a very intricate matrix with a lot of fibers that are actually avoiding the deep penetration of these particles from a perivascular position all the way deep into the tumor. So these are still data generated by the lab of Rakesh Jain showing that fluorescently labeled particles in the order of 90 to 100 nanometers that have been systemically injected, they are able to cross the fenestration in this tumor, but they do not navigate, they are not transported deep into the tumor. They stay in a perivascular positions. And also you can actually see from these image, which is an intravital microscopy, still image coming from an intravital microscopy movie, that there are vessels that are actually not lined up by these red fluorescent particles. So there are vessels that are actually not touched at all by the nanoparticles because of a intrinsic high heterogeneity in the tumor. So you had two effects here. The EPR effect that is somehow not present in all the tumors, at least not at the same level. And then you have a difficulty of the nanoparticles that are in the 150 nanometers in size in traveling deep into the tumor. So the strategy that we have been using and developing and that we have been basically, that has been inspiring us in the development of our nanoparticle is based on what macrophages and platelets, I should say, have been doing for forever, basically. So macrophages, they're able to sense the overexpression of specific molecules on the endothelium, and then they are able to stick to this endothelium, adhere to this endothelium, following a very complicated process of tethering, rolling, and eventually adhesion. And then, of course, they're able also to perform this fantastic process of diapedesis, through which they actually are able to open up the endothelium, deform, and penetrate into the extravascular matrix, getting all the way to the inflammatory source. Our nanoparticles are not able to do, of course, the final step in this process, but they've been designed to navigate into the vascular system. They are able to recognize specifically the tumor vasculature, and they are able to sit on the tumor endothelium, and from there release smaller nanoparticles and molecules that now will be 20 nanometers or even smaller and can navigate deeper into the extravascular matrix. So in a sense, they are sitting still in a perivascular position, but they're not sitting in a abluminal position, meaning in this area as the small liposomes or the small polymeric nanoparticles would do, but they're sitting on the other side, on the luminal side. Of course, we have also to keep in mind that another component that is actually helping us in targeting and specifically targeting the tumor vasculature is associated with the notion that there are these vascular zip codes. So the endothelium and the surface of the endothelial cells carries a number of molecules, receptors, which are specifically expressed on the diseased tissue, or they are overexpressed on the diseased tissue. And this is work done by Renata Pasqualini and Wadi Arap, that were originally at the MD Anderson Cancer Center, and now they moved to the University of New Mexico. And they've been using this phage displaying peptide approach in order to identify specific receptors, not only related to cancer, but related to cardiovascular disease, neurodegenerative disease, which are again disease where you need somehow to target the vasculature because there is no EPR effect. And so again, if you want to have a more general approach of nanotechnology to medicine and potentially use the same nanoparticle, the same device, the same nano device for imaging neurodegenerative disease, for imaging cardiovascular disease, for imaging cancer, for treating, then maybe targeting the vascular network, the disease vascular network, could be a more general approach. So in our laboratory, we have 4 different platforms, 3, but actually 3.5, I should say, 4. You will see that there are 4 slides. Some of them rely on the EPR effect. Some other have been, as I said, designed only to target the tumor vasculature or the disease vasculature. So these are discoidal polymeric nanoconstructs, the one that we have been developing over the last 3 years. And they are discoidal in shape, and you will see in the next slides why they have to be discoidal. They're made out of polymers, which provide a number of advantages. And you can actually control very accurately the size, the shape, the geometry. In these particles, you can actually also control the mechanical stiffness as well as the surface electrostatic charge. So you can control what we have defined the 4S parameters in the rational design of the nanoparticles: the size, the shape, the surface properties, and the mechanical stiffness. And you will see that by playing with these parameters, you can actually change very important properties and features of these nanoparticles in terms of targeting, circulation half-life, and ability to evade the immune system and the recognition by the MPS. We do have also spherical particles that would rely only on the EPR effect to accumulate into the diseased tissue. These are the classical particles that a group of Bob Langer and Omid Farrokhzad at Harvard Medical School have been developing, and we are mostly using these as probes in order to compare our discoidal nanoconstructs with the spherical particle. These are very classical. They have a polymeric core that is, in this case, PLGA. You can load whatever you want as long as it is hydrophobic. And then you can stabilize this PLGA core with a monolayer of lipids and PEG. Here, you will see the structure is a little bit different, and we'll talk about that in the next slides. We're also working on iron oxide nanoparticles, nanocubes, iron oxide nanocubes. Again, the spherical shape, yes, it's fine. It's probably the easiest that you can get because self-assembly and energy minimization will take you to a spherical shape. If you want to deviate from spherical shape, of course, you have to somehow use different approaches. But there are a lot of features that you can introduce in your system if you start playing with non-spherical shape that a classical conventional spherical nanoparticles will not provide. And so this is a relatively new platform. I guess there are only 3 groups in the world that are right now developing iron oxide nanocubes. One is in Italy, one is in Korea, and actually I have a Korean postdoc that is actually developing these particles in our lab, and her name is Minjun Cho. We are using these particles not for direct imaging of the tumor, but we are loading them into the discoidal polymeric nanoconstruct for providing a number of functionalities that we will see later. And then, of course, we have been working a lot, and I'm still continuing working with the silicon mesoporous particles, which are discoidal in shape, and these were being developed within the group of Mauro Ferrari at the Houston Methodist Research Institute over the last 10 years, and probably even more. And they are discoidal in shape, and it's not by chance. And we can control, even in this case, the geometry. We can control the surface properties. We can control, so with geometry, size, and shape, of course, but we cannot control the mechanical stiffness of these particles, which are, of course, rigid. And so the discoidal polymeric nanoconstruct actually provide the 4th S in the rational design, which is the mechanical stiffness. Here we basically have 3S, the size, shape, and surface properties. Now, my background is in mechanical engineering. I've been working a lot in modeling. 10 years ago, I switched to bio, and I had to learn a lot of things. And I learned these a lot of things by moving from a classical school of engineering into a medical school. And that's actually the only way that a traditional mechanical engineer can be then exposed to the medical community and learn as much as possible without following the traditional path of a biomedical engineering student. or a biochemist, a biologist, a pharmacologist, and so on, which are naturally more exposed during their coursework to the bio world and the bio community. On the other end, of course, the advantage of being a more traditional engineer is that, of course, you think as an engineer, and the first thing that you try to do is to optimize systems. And so the first question that I pose is why most nanoparticle systems have tumor accumulations which are in the order of a few percentage of the injected dose per gram tissue. So as an engineer, this is a very inefficient system. Most of the nanoparticles that are out there, spherical, 100 nanometers, circulating for 24 hours, circulating for half a day, no matter what, they have accumulation doses in the tumor which are of the order of 1–2% of the injected dose per gram tissue. Many of them are treating tumors quite efficiently, no question about that. But as an engineer, you have to question why we cannot move that to 10% of the injected dose, 20% of the injected dose. Nanoparticles are beautiful because they are multifunctional. And they are multifunctional meaning that they can carry a lot of molecules. You can do combinatorial therapy. You can do multimodal imaging. But you need to have a certain dose of those particles ending up in the tumor. And it has to be sufficiently large in order to exploit all this functionality in doing detection, diagnosis, therapy, different type of therapies, and so on. And so the integrated framework for the rational design is basically based on the combination of three different modules, which are a computational module, engineering, we do a lot of computation, and then, of course, in vitro and in vivo analysis, because you can do beautiful computation, you can do beautiful, present beautiful data with beautiful plots, curves, and colors, but you have to convince that what you are predicting is actually happening, at least in being able to predict the trends, not the actual values, because the actual values, we're dealing with a biological system, so the variability intrinsic in the system is so high that you won't be able, in my opinion, to detect accurately the values, how many particles accumulate into the tumor. But you can actually predict and understand trends, and you can do optimization, which is what we have been doing over the years. And we have been doing that because we have a very strong computational and mathematical background that, again, with the years spent within a medical school has been also we've been learning of how to run experiments in vitro and in vivo. Whenever you approach a medical doctor, being that in Italy, in Europe, or in the US, you need to get to the doctors with something that is, I won't say close to going to patients, but well developed. Otherwise, they won't talk to you. They will say, okay, yes, interesting, but then that's the end of the story. You cannot go to a medical doctor presenting computational data, predictions. They want to see in vitro, they want to see some in vivo data. So we had to develop a number of things directly in our lab, but we learned it over the last 10 years, and I think that that has helped us a little bit in succeeding in this field. So let me guide you quickly through the computational modeling without getting into the details, but just providing you the summary and the concluding remarks. So when you are injecting nanoparticles into the bloodstream, of course these nanoparticles are surrounded by blood cells, and in particular red blood cells, 35–45% hematocrit, meaning 45% of the volume of the vessels is actually occupied by red blood cells. So what is the interaction between nanoparticles and red blood cells? Can we somehow exploit that in order to increase the accumulation of these nanoparticles at the vessel walls? And the answer to that is, of course, yes. But before getting to the answer, what we did is a systematic analysis looking at what happens at the trajectory of particles that are immersed in a virtual vasculature to the trajectory of particles that are spherical, in this case very simple, ranging in size between 10 and 100 and 1,000 nanometers, 1 micron. And so you could clearly imagine that the smaller nanoparticles, the 10 nanometers up to 100 nanometers, they are so smaller compared to the red blood cells, which are 5 micron, 6 micron in size, that would navigate within the red blood cells without too much interfering with them. But if you start injecting a particle that is comparable in size to the red blood cells, 1 micron size, then there will be some interactions. So you might know that platelets, which is, of course, one type of blood cell, 1 micron, 2 micron, 3 micron in size, they actually exploit the presence of red blood cells in order to stay confined near the vessel walls, sense abnormalities in the vessel walls, and intervene when it is necessary. So somehow, somebody said, and many said in the previous talk, that we need to look at nature in order to design our system. So if you look at what platelets and the interaction between platelets and red blood cells is in nature, is that red blood cells, far more abundant than the platelets, deformable, they tend to push laterally the platelets and confine them in what is called the cell-free layer. So these platelets are forced by the presence of the red blood cells to stay near to the vessel walls. Now, if you want to design a nanoparticle that should be able to recognize the disease vasculature, you might want to mimic platelets. And so if you look at the trajectories now of these particles, and if you look at the 10 nanometers, 50 nanometers, 100 nanometers, their trajectory is not disturbed by the presence of the red blood cells. But if you look at 500 nanometers, 1000 nanometers, the first things that happens to these particles is that when they encounter red blood cells in their travel over their journey, basically the red blood cells push them laterally and force them to accumulate in the so-called cell-free layer. And this is exactly what we want to do with nanoparticles. We want nanoparticles to be able to sense the presence of abnormalities in the vessel walls. And these abnormalities could be a fenestration, could be the overexpression of receptors. So we need to have nanoparticles that are able to navigate the vasculature in close proximity of the vessel walls. And this is the reason why we're working with micron size and sub-micron nanoparticles. We're not working with 100 nanometers, 200 nanometers nanoparticles. The discoidal particles that I've shown you, both the polymeric as well as the mesoporous silicon particles, they are 1000 nanometers by 400 nanometers, so they have a size which is in the micron and an aspect ratio which is comparable to that of platelets, because we want to somehow exploit the benefits of the interaction of these particles with the red blood cells. Now, this was somehow known in the physiology community because of the platelets. We had done a number of experiments beside the computational modeling, which is actually quite sophisticated. And we have shown with intravital microscopy, by injecting these particles systemically and looking at the hair and the vasculature in the hair of the mouse, we have been looking at how these particles would distribute within the vessels. We have also a couple of movies showing that the 200 nanometers particles actually tend to distribute quite uniformly within the vessels, whereas the larger particles, 1000 nanometers, they tend to be pushed laterally. And they actually are rolling on the vessel walls, as you would see macrophages rolling on the vessel walls on the venous side of the vasculature. Now, another important concept that I think we were the first somehow to introduce or justify was that of using non-spherical particles for targeting the vasculature. And this was, again, initiated through computational modeling. And we showed that if you start using non-spherical particles, you can actually have these particles drifting laterally across the vessels and tend to accumulate towards and move towards the vessel walls. If you have a spherical particle, this particle is symmetric with respect to the flow and will follow the streamlines. If you have a non-spherical particle, the dissymmetry introduced by the spherical particles will actually support this lateral motion of the particle, radial, and so not only will move longitudinally along the vessel wall's axis, but will also move laterally and will get, again, into the cell-free layer. So among all the shapes that will favor this lateral drifting, the discoidal shape is actually the most efficient. And so This is again the reason why we are working with discoidal particles, submicron, micron in size, because these particles will be somehow better than others in approaching the vessel walls and moving in the proximity of the vessel walls. Now, particles has to also get to the vessel walls and adhere to the vessel walls. Another computational modeling that we have done back in 2006, they actually shown that if you have a discoidal particle, these particles will be more efficient than spherical particles in the addition to the vessel walls. And this is easy to understand. If you have a discoidal particle, the surface of addition of the discoidal particles with the vessel walls is much larger than the surface of addition of a spherical particle, which nominally is one single point. Right? You have a spherical particle sitting on a flat geometry. The contact between the particle and the geometry is a single point. If you have a discoidal particle with a major base, a circular base, you have multiple point of contacts, which means multiple ligand and receptor bonds that can be generated simultaneously. So a stronger addition that you can actually achieve. And so, again, this is the reason why we're looking and using discoidal particles. Now, of course, we have done a number of first in vitro, then in vivo experiments to support these. And the in vitro experiments were performed using a parallel plate flow chamber, very classical system. You flow the nanoparticles in. This is the flow deck, and this is actually the chamber where you see your fluorescently labeled particles flowing. And then with a fluorescent microscope, you can actually track the particles over time. You can look at the dynamics of addition, decohesion, and so on. And here in this room, it's Annalisa Palange, who is sitting here, that has been working extensively on these systems and characterizing their in vitro properties. So we showed using these systems that if you look at the addition of discoidal particles that are coin-shaped, so thin discoidal particles versus spherical and versus quasi-hemispherical particles, because the first version of the silicon mesoporous particles was not discoidal, was quasi-hemispherical, you actually have the discoidal particle adhering and sticking to the bottom of this chamber in a larger number as compared to the quasi-hemispherical and compared to the spherical, for the reason that I just said before. More recently, we ran other experiments, and we confirm that there is actually an optimal size of these discoidal particles, 1,000 by 400 nanometers, which would maximize the addition to the vessels, so the addition to this chamber under flow, regardless of the shear stresses and the shear rates, so regardless of the hydrodynamic conditions. What is very interesting also is that when you get to the physiological shear rates, 200 second verse 1 and even larger, the addition is very minimal. The addition is large at sub-physiological shear rates, but these sub-physiological shear rates are exactly the shear rates that you will find in a tumor vasculature. So this is telling you that these particles, because of their size, they will tend to be washed away from the vessels in the normal vasculature and will tend to stick and deposit and lodge in the vasculature with sub-physiological hemodynamics conditions, which is again the tumor vasculature. So these are all physical, biophysical means of targeting the particle into the tumor vasculature. We're not using any ligand and receptor bonds so far, it's only physics. Of course, we show that the discoidal are more efficient than the cylindrical at a fixed volume. There are, of course, papers out there that say the opposite, but they are not considering a fixed volume, so it's not a fair comparison. And then we perform in vivo experiments using intravital microscopy. I won't go into the details because we have seen already very nice presentations the day before yesterday and yesterday regarding intravital microscopy. And we injected two different types of particles, 600 by 200 nanometers discoidal and 1,000 by 400 nanometer discoidal. And we look over time at the accumulation into the liver and the accumulation into the tumor. If you compare to these two plots, you see something that intuitively is not that easy to understand, following the common credo and the common dogma. The larger 1,000 by 400 nanometers particles are actually accumulating in the tumor more than the smaller And in the liver is happening exactly the opposite. The larger particles are accumulating more than the smaller. And we'll get back to that. Then you do quantification. How do you do quantification? You can do that with intravital microscopy, but it's optical imaging, and optical imaging is not really super quantitative because it depends on many things, including the location of the particles within the tumor. So it is good, it's easy. There are systems that can do whole animal optical imaging, but their accuracy in calculating accumulation within the tumor and within the other organs for biodistribution study, I would question that. And so what you see in the tumor is that these mesoporous silicon particles, in particular the 1000 by 400 nanometers, accumulate more than the larger, 1800 by 600, and more than the smaller, 600 by 200. Which is somehow what the computational model as well as the in vitro experiments that I've shown before were actually suggesting. So somehow in vitro we do see again the same behavior that we have seen in vivo. We do see the same behavior that we have seen in vitro as well as in silico. I'm also presenting the data of the accumulation in the other organs because this is a biodistribution. And we got, of course, our good 20–25% of accumulation. This is normalized by the organ size. In the liver, we do have in the spleen, we do have in the lung, especially for the larger particles. But this is common to all nano. Sooner or later, of course, if they circulate longer later, the particles will then end up in the reticuloendothelial system, no matter what. And so these particles have a circulation half-life which is very short, a couple of hours. They are not pegylated. They are bare silicon particles. They get to the tumor with 5% of the injected dose without any type of ligand, 5% of the injected dose per gram tissue without any type of ligand. And this is not optical imaging. This is ICP, chemical analysis on the amount of silicon that has been actually detected into the tumor tissue. The larger particles, the cylindrical particles have serious problems in the lungs with inducing also the death of the animals. If you add an RGD4C molecule on the particle, you do some specific targeting, RGD4C that is targeting the alpha V beta 3 integrins, you do see an increase in accumulation. The trend with the smaller, the larger, and the average size in the middle is still preserved. We're getting 8% of the injected dose per gram tissue. This is we tested this in two different tumor models. These are the melanoma data, but we have also cancer developing into the breast, as well as data from other investigators still in the Ferrari group supporting these. Godin-Biana has been working also on these significantly. Now, in the liver, almost the totality of the particle, 90%, they end up in the Kupffer cells. Not surprising. Some also in the spleen. But it's also the reason why, if you remember, in the liver, we do see the 600, the smaller particles, 600 nanometers accumulating more than the larger. Because if the particle is smaller, it is uptaken by the macrophages at a faster rate as compared to the larger particles. And so if you actually then extrapolate these in vitro data and use this to interpret the in vivo data, you end up realizing that the smaller particles are ending up in the liver more because they are internalized more rapidly by the Kupffer cells. The 1000 nanometers, they are ending up more into the tumor because they are less internalized compared to the 600 nanometers in the liver, and they are better designed to lodge passively within the tumor vasculature. Now, let's move to the discoidal polymeric nanoconstructs that I said we have been developing over the last 3 years. We published one paper last year in Biomaterials, and we have this other paper that is now pending editorial decisions on a journal. But basically, the idea is to keep, again, the size and the shape, still discoidal, because we have shown that discoidal is good. If you want to target the vasculature, and I want to emphasize that, if you want to target the vasculature, if you want to rely on the EPR effect, there is nothing bad about that. But you won't be able to use these particles. These particles have been designed specifically for targeting the vasculature. So these particles are discoidal in shape. We use a proprietary method for their synthesis, and we basically obtain them by mixing together two different types of polymers, PLGA and PEG, with two different types of lipids. So these are particles that are not obtained through the classical method. Nanoprecipitation, you have a core that is made out of PLGA, and then it's coated with a single lipid monolayer, and then you have these PEG chains that are coming out. These are two different polymers and lipids that are entangled together. And they are forming a very complex matrix which is still very porous, and now has domains that are hydrophobic, domains that are hydrophilic, and then you have these lipids that have their own functionalities. This lipid here, we use it for fluorescent, for imaging, optical imaging. This lipid here, lipid DOTA, we use it for MR imaging because the DOTA cage can be used to carry gadolinium ions. But we also use this for nuclear imaging because the DOTA cage can be used for carrying copper 2+ ions. And so now you have a system that can do MRI imaging, that can do optical imaging, that can do nuclear imaging, that can load iron oxide nanocubes, which are all dispersed within the same matrix in a single passage. And so you can do a number of other things that you will see. Classical physical-chemical characterization, SEM images, AFM images, optical imaging. The size is clearly, the shape is clearly that of a discoidal particle. You can see that basically it is, the base is circular, and then laterally you can see this small cross-section. Size, very well characterized, and then TEM of the core of these particles loaded with a bunch of iron oxide nanocubes that will provide MRI, magnetic guidance, and ablation therapy properties. And then, of course, the final step is the chelation with a copper-64 for nuclear imaging. The geometry can be changed, discoidal, but it could be discoidal with a circular base, it could be discoidal with a rectangular base, and you can have a quite nice accuracy in their size and shape, so the geometry can be quite nicely controlled. They are deformable. So if you take this little syringe here and you put your solution with these DPNs, a Discoidal Polymeric Nanoconstruct, and you push it, then you see that there is a filter here with different pore size. You can actually recover the particle at the bottom, and the particle have the same geometrical properties as the original particles. Of course, some of the particles, this is a SEM of the pore in the filter. Some of the particles will be depositing here, but many of them are actually crossing these pores. And they are crossing these pores all the way down to 400 nanometers in size, and these are 1,000 nanometers. So they are deforming, they are passing through these pores, and then once they pass through the filters, they will recover their original geometric properties, which is a very important parameter, and for a number of things is crucial also in the biodistribution. Then, of course, the first thing that we did, we went in vivo and we tried to understand what is the biodistribution of these particles. And we did PET, nuclear imaging. Why? Because it's super accurate. It's actually the most accurate imaging modality that you can get, and it's very clinically relevant. You inject these particles, you look at their accumulation in different organs. Of course, you have a nice tumor that is developing here on the flank of the animal. These are the CT images, and this is the PET-CT images that are basically combined together. These are images that have been normalized for the activity of the copper, and so they can be compared at different time points. They can be compared directly. You see that there is a significant activity coming from the abdominal cavity and from the liver. We believe that these are particles that are circulating in the liver. The liver is one of the organs that is more perfused. There are a lot of vessels, and if the particles circulate for a long time, you will see that signal coming from the liver. And the signal, of course, decays over time, but is not a nuclear, is not the decay of the signal from the copper-64. It's the fact that the particles over time, they are progressively accumulating into the tumor, and so there are less and less particles that are circulating, and so the signal coming from the anomalous cavity is somehow reducing. When you get to the accumulation into the tumor percentage of the injected dose per gram tissue, we are getting quite interesting values. We're getting up to 20% of the injected dose per gram tissue and even larger. And these are untargeted particles. These are untargeted particles that are using the same mechanism that I've described for the mesoporous silicon particles to accumulate and lodge into the vasculature. Physical means, physical mechanism. And these particles, which are 1,000 by 400 nanometers in size, they have a circulation half-life. This is the percentage of the particles in the blood, normalized by the volume of blood. They have a circulation half-life of the order of a day, 1,000 by 400 nanometers, circulation half-life of about a day. And we believe this is happening because they are deformable. And they can squeeze through the smaller vessels, and they can resist internalization by macrophages, and I guess you will see also in the next slides some data. So this is the liver of an animal that is alive. That's why you see this out of focus. It's breathing, so the liver tissue is coming out, in and out of focus. This is a type 2 mice, so it's a mice that is being genetically modified in order to express GFP in the endothelium, and so all these green areas here are basically the endothelial cells. Blue are the macrophages, if they are still, or are the red blood cells, if they are moving, and red are the particles. So you can clearly see here that there are some trains of particles that are moving in the vessels, other that are somehow stacked into the vessels next to the macrophages, the professional macrophages of the liver, which are the Kupffer cells. This is what happens when you inject 700 nanometer spherical beads polystyrene. They immediately get into the liver and they saturate the liver to the point that the animal dies after a few minutes post-injection. This is 2 hours post-injection, and you still see these particles circulating. Some of them, of course, have been uptaken by the Kupffer cells, but most of them are circulating. What happens into the tumor? This is what happens into the tumor. Same type of animal. Green is the endothelium. Red are the particles. Blue, here you see that there are a lot of blue moving elements. Those are the red blood cells. Okay? So there are not many macrophages in this tumor. And you can clearly see, this is 2 hours post-injection, that you have all these particles here that are actually accumulating into the tumor tissue with still red blood cells that are circulating in blue. Of course, movies are nice. Let's see we have done some also quantification of these images. These are the accumulations in the liver and in the spleen for the DPNs and the polystyrene particles. The DPNs are 1,000 by 400. The polystyrene are spherical 700. 3 order of magnitudes difference in vivo. 3 folds, not 3 order of magnitude. I wish it could be 3 order of magnitude. So it's 3 times lower the accumulation of the DPNs compared to the PS. And all these analyses done by Annalisa Palange again, she has been working on multiple projects within the group, shows that in the tumor, the particles are actually within the vessels. They are not extravasating. They are depositing within the vessels as the theory and as the in vitro models have been predicting. Now, what happens where we incubate DPNs, red here, with J774, murine macrophages? Notice that the murine macrophages are moving around, so they are quite active. What we notice is that the DPNs tend to dense somehow around the macrophages. They get into contact, transient contact with the cell membrane of the macrophages, but they do not stimulate any phagocytic process. In contrast, this movie here is comparing side by side the famous polystyrene particles with the DPNs. The polystyrene particles, as they deposit, they are immediately uptaken by the cells. The DPNs are still moving around without stimulating any phagocytic process. Quantification. Well, first of all, it's nice to follow the trajectory of the particles and the trajectory of the cell nucleus, meaning that the cell is active, is moving around. The particles are also moving around, but their trajectory is not associated with the trajectory of the cell. So they're not, neither are adhering to the surface of the cell, nor have been internalized by the cells. And then you do some nice FACS analysis. Again, this is a contribution of Annalisa Palange, and you can quantify also the accumulation of these particles and compare into the macrophages and compare the number of DPNs versus the PS, and clearly it is again confirming what we have seen in Vivo. And then, of course, since we were developing these new particles, we did also some preliminary cytotoxicity analysis in vivo and in vitro, and this is work again of Annalisa with Cinzia Stigliano, that is also sitting here in the audience, that has been looking at the in vivo cytotoxicity, and there is no sign of any type of cytotoxicity. So I guess that if we want to summarize this first portion of the talk, clearly what we need to keep in mind is that if you want to target the vasculature, I'm going to repeat it again, if you want to target the vasculature, discoidal particles in a sub-micron size are actually more effective than any spherical particle because of the margination dynamics, because of the interaction with the red blood cells, because of the adhesion to the vessel walls. If you use polystyrene particles that are sufficiently deformable, you can actually evade, to a certain extent, the RES system and increase dramatically the accumulation. 20% of the injected dose is a very high accumulation into the tumor without using any ligand, without using any other biological method beside the physics. Now, once we have developed the nanoparticles and we have identified the right size and shape, what we did is also provide some functionality. And the first thing that we work on is imaging. Why? Because you need to do imaging in vivo in order to understand where the particles go if you want to improve their performance in vivo. You definitely need to do some imaging and multiple imaging modalities. So in this paper, what we did is we confined within the mesopores, and now we're going even more into the physics, but I'll try to be very quick also because I think that in terms of time, what is the time now? I can't see the watch there. Clock. 5 to 3, okay. But I don't see Dan here, so I will continue. As long as I don't see him coming. I hope that Peter is keeping him busy outside. So basically we confine within these mesoporous silicon particles, we confine different type of, then you were supposed to stay outside another 30 minutes. So we confine with this, within these mesoporous silicon particles different types of gadolinium-based contrast agents. A clinical one which is Magnevist, the DTPA, and then fullerenes loaded with gadolinium, as well as ultra-short gadol nanotubes, which are developed at Department of Chemistry of Rice University, which is across the street compared to the Methodist Hospital Research Institute. And what we showed is that we can dramatically increase the relaxivity. So basically, by playing with these mesoporous silicon particles, as well as with the Discoidal Polymeric Nanoconstruct, you can actually dramatically increase their efficiency as contrast agents for MRI. Let me say this, if you don't, yes. So the data that I showed before were with gadolinium. Then what we did is we load iron oxide nanoparticles within both the mesoporous silicon particles matrix and the polymeric matrix of the DPNs, and we have seen the same enhancement in terms of relaxivity. So these platforms, by using the confinement of the water molecules within the pores, we can actually dramatically enhance the relaxivity. If you look at these highlighted area here, you can actually go from the 100 millimolar second verse 1 in terms of relaxivity of the 5 nanometers to SPIOs. You can go all the way up to 800, and this is among the highest value in terms of relaxivity that I've seen around. And there is a theory behind that, because again, coming from an engineering background, we always try to see, of course, nature, learn from nature, but also to understand nature. And there is a very nice theory that has been developed by a number of colleagues at the Politecnico Torino, including Matteo Fasano, who is sitting here in the audience and has been running hundreds of molecular dynamic simulations in order to actually develop a theory that would support the notion that if you confine superparamagnetic iron oxide nanoparticles into mesopores, either polymer or silicon, you actually get an enhancement. Now, I want to just 3 slides, if I can. We are all familiar with magnetic drugging and magnetic guidance. It is not a new concept, but I think that by confining iron oxide nanoparticles into larger vectors like the mesopore silicon particles and Discoidal Polymeric Nanoconstruct that we are developing, you can really get the most out of this approach. Why? Because magnetic forces are volume forces, and volume forces do not like nanotechnology. We learned it from the previous speaker. They scale with the size at the cube, and of course all the surfaces forces, they scale with the size at the power 2. And so the only way to increase the efficiency of magnetic drugging is to confine multiple SPIOs within one single molecule. And now you can use magnetic drugging in vivo, and these are very recent data last week showing with the Discoidal Polymeric Nanoconstruct that you can get all the way up to 20% of the injected dose and even larger, 25%, in only 24 hours. Previously, it was 48 hours. We were getting 20% at 48 hours. Now we are accelerating the process of deposition into the tumor. 24 hours, already 15% in 3 hours. And 3 hours is the time that we're keeping the magnet on the tumor of the animal. So if we can keep probably longer, then this can become 30%, 40%. And now we are using just magnetic drugging, no ligand receptor interaction. And I think that with that I can actually close. There are many different things. I would just thank the group, multiple people that have been working on that, and the agencies. This is a very old picture of a couple of years ago. The group has been changing a little bit. I've been changing also significantly. A number of agencies, and also very recently a European Research Council that will start soon supporting also the activity on the Discoidal Polymeric Nanoconstruct with a grant that is specifically dedicated to that. Thank you. Sorry for keeping that a little long.
Thank you very much for the enlightenment.
I've seen that you have been following every single slide of my presentation.
I know some.
Yeah, of course, of course.
Questions? Please.
Thank you for the presentation. It's very nice and it's a shifting kind of paradigm. So I have 2 questions. First of all, is it possible, how do you see to use these discoidal particles to inject with drugs? I mean, instead of those nanocubes, can you use some polymers or something else?
Yeah, I haven't shown the data, but actually Cinzia and Annalisa are working right now very actively in loading these particles with multiple drugs. These are chemotherapeutic, classical, traditional chemotherapeutic drugs, as well as anti-inflammatory drugs. For a number of reasons, we would like to follow this approach. And actually, Cinzia is starting as soon as she gets back to Houston a pretty long animal study, efficacy study, that I'm pretty sure will keep her in Houston, unfortunately, for all the summer. And so I guess that in the next few months we will have also those data. We have no problem in loading hydrophobic and hydrophilic drugs simultaneously. We have been doing all the in vitro characterization. I didn't show them here. We're now doing the in vivo efficacy studies.
So the take-home message is not
No, the take-home message is that he has to go back because it's quite significantly expensive study, and yes. I told her either you stay in Houston for doing these experiments and you finalize the experiments, or you finalize the experiments and you stay in Houston. Those were the two options.
The second question, how do you see these nanoparticles, or how do you predict would react in inflammatory diseases and what kinds of where you don't have this KPI effect, you have this enhanced permeability, but not the same as tumor. So do you think it will be the same mechanism, will be the same accumulation or less? Or
If you have some level of permeability, you will have a lower blood flow velocity locally. And so these, as I said, will favor the lodging of these particles. But if you don't have that, these particles are moving next to the vessel walls and they are sensing the presence of expression of receptors. We've not been working beside the RGD4C and beside the anti-LFA1 work that we are developing now with Damper. We have not been working a lot on the use of ligands and ligand-receptor interaction because I wanted, first of all, to clarify a number of basic physics and biophysics approaches, which are, I think, a little bit different from the classical ligand-receptor approach. But again, if you have something that has a huge surface area, which is 1,000 nanometers in diameter, and you have a large number of ligands that you can actually attach on that surface, the probability that they will recognize a few molecules expressed on the endothelium, specifically expressed on the endothelium, is very high. So I'm pretty confident that as soon as we will include also that other component into the platform, vascular targeting won't be a problem, neither for cardiovascular nor for neurodegenerative disease. But again, based on what we have been predicting and observing, we have to test it. And actually, Annalisa is working on that. Now that I remember, yes, Annalisa is working in a flow chamber system with these particles that are actually chelated with a small molecule that have been developed by a collaborator in our department at the Houston Methodist Research Institute for targeting, again, alpha V beta 3 integrins, but it's not an RGD4C. It's completely different.
Yeah, did you observe the formation of clusters of aggregated particles?
No, and we don't see that, not even with the nanocubes inside, because the nanocubes are 20 nanometers in size, so they are still super paramagnetic, and they will become magnetic, which will foster the agglomeration and support the agglomeration only in the presence of the magnetic and external magnetic field. And that's actually one thing that we are using. If I may, this slide that I couldn't comment on, here we're showing that if you are applying a magnetic field on these particles are actually working and functioning as a local magnetic dipole that is actually attracting other particles that are passing nearby. And we have seen that also in Vivo. So, but if they're not exposed to a magnetic field, they are not magnetic.
One question. So the main driving force here is the shell rate. And you made the point that the shell rate is definitely high. Elaborate on that. We expect that you have a lot of values in the shell rate.
Yes, but the particles are big, and they are in a micron size. So whenever you go above a 100-second verse 1, which is the minimal physiological shear rate, the hydrodynamic forces or the hemodynamic forces on this particle will be too big for them to stably adhere to any other surface. And so especially for the discoidal polymeric nanoconstructs, within the first hours, 2 hours of imaging with PET, what we see is a lot of signal coming from the lungs, and the particles are actually staying for that time within the microvasculature of the lungs. But then because of their deformability, they are coming out, so they're not staying there. But this is also something that we are using, for instance, for targeting lung cancer. Because in lung cancer, on the other end, you will have those hydrodynamic conditions that will reduce the hemodynamic forces, and these larger particles will be able to accumulate. And with lung cancer, we are seeing actually lung cancer as well as melanoma metastasis into the lungs. We do see significant accumulation, and these are other studies that we are developing with PET imaging, showing clearly after a few hours that the lungs have been washed, but you see these mets and the primary tumor that is actually highlighted.
Okay, thank you so much.
Thank you.